I think that as our data kind of indicate, the use of next generation sequencing in the care of breast cancer patients is something that I think is going to continue to expand. And I'm really excited about that because we saw with the approval of alpelisib and hormone receptor positive breast cancers that there are these mutation-driven tumors that can respond to targeted therapies. We know that about BRCA mutations and PARP inhibitors, and I think we're just scratching the surface there with breast cancer. And I'm really excited to see how plasma-based testing can augment care in hormone receptor positive breast cancer, specifically for those patients who've got bone-only disease or difficult to biopsy disease. I think that 2021 is going to offer a lot of interesting insights in what we can learn from the genetics of those patients, and if we can develop new targeted therapies in the space of breast cancer.
Another exciting trend that we saw is that triple negative breast cancer patients are increasingly likely to get NGS profiling. And again, we have some ideas as to why that may be. And one of those ideas is that physicians are trying to uncover a targetable mutation in this patient population that has historically been difficult to treat. So I think for me personally, looking forward, I'm anxious to see if some new therapies, new therapeutic options can emerge for these groups of patients that have historically just not had many options.
Maybe one last little tidbit here about what's on the horizon. We have the pleasure of working in a research network that's got numerous ongoing clinical trials. One thing that we also looked at was the presence of these resistance mutations in the estrogen receptor gene that usually emerge in response to anti-estrogen therapies. And I think, again, that's another area that we're very interested in from a drug development point of view, developing the next generation of oral SERDs and SERMs, modulators and degraders of the estrogen receptor that target specifically these mutant forms of the estrogen receptor. And really following how these patients do over time. Again, I'll just plug for the plasma and liquid biopsy space, that being able to monitor when those mutations arise in a patient's treatment, and then knowing that that's the time to switch therapies to something that really targets these resistance mutations. Sequencing that, all of those things I think are really exciting. And our data certainly encourage people, and encourage me anyway, that testing in this space is something that needs to continue to grow.